So for patients who have FLT3 mutated AML that have failed one prior TKI therapy, for example, patients who have recurred after receiving midostaurin in the upfront setting, we have other newer generation FLT3 inhibitors on the horizon. Gilteritinib, as I mentioned previously, is been submitted for accelerated consideration for approval in the relapse refractory setting. Quizartinib, another newer generation FLT3 inhibitor, is completing phase 3 studies to look at its response in both the upfront and the relapse refractory setting. There is another inhibitor, crenolanib, which is being tested in the newly diagnosed AML setting in a phase 3 trial comparing that tyrosine kinase inhibitor with midostaurin as upfront therapy for patients with newly diagnosed FLT3 mutant AML. Things that we need to keep in mind when selecting another tyrosine kinase inhibitor after a prior tyrosine kinase inhibitor failure is whether the patients failed based on tolerability issues or whether they failed based on efficacy issues. Patients who are not able to tolerate, for example, midostaurin because of gastrointestinal problems, nausea, vomiting, inability to take that medicine for any reason or interactions with other medicines, can easily be considered for another tyrosine kinase inhibitor that has a different side effect profile. However, if patients have failed, for example, a tyrosine kinase because of lack of efficacy, we need to take a little bit closer look. That's when next-gen sequencing can come into play in the identification of tyrosine kinase domain mutations in FLT3 that may help us in the selection of newer drugs. One also could look for development of other mutations or other pathways that could have been upregulated after treatment with the drug, for example, that targets FLT3 ITD but does not target TKD. So I think it's important to look at those causes and the reason for why the person failed the first TKI in selecting one of these newer agents, similar to what we do when patients fail a BCR-ABL tyrosine kinase inhibitor, looking at the profile, the safety, the tolerability, and the presence of resistance mutations.